Good morning and welcome back to my channel PT Rad Academics. Today we are going to discuss about radiation therapy. So from the topic you understood that understanding more about radiation therapy. Radiation is used for therapeutic purpose. Therapeutic purpose means radiation is used for treatment. You might have heard about radiation before, right? When we are having some fall and immediately some swelling happens, and if we are having some fracture, we immediately, if we are suspecting some fracture, we immediately rush to a hospital for taking an X-rays. So X-ray is a type of a radiation, and through that we are acquiring X-ray images. With that, we are coming to a conclusion that whether we are having any fractures or anything we are having, with the doctor is reading or the radiologist is reading from the X-ray images. Likewise, the radiation is used for treatment purpose. Let us move ahead for more slides to know more about radiation therapy. So again we are moving on to the introduction. Radiation therapy, RT in cancer treatment. So from the first slide, from the first introduction, you understood that we are giving radiation as a treatment. So from this sentence itself you understood to whom we are giving this radiation. We are giving this radiation as a treatment purpose to cancer patients, and it depends upon many factors such as the type of cancer. Some cancers are very sensitive to RT, so it can be easily destroyed by radiation. Such example is lymphoma, and some cancers are resistant to treatment. For one example for that is melanoma. So depending upon the cancer, we will determine whether it is responding or sensitive to radiation or not. Then the efficiency of other modalities, or all the modalities should be used together or alone. So the oncology department comes under three branches: surgical oncology, medical oncology and radiation oncology. So when a patient comes to our department, for example a breast cancer patient is coming to our department, we have to determine many factors, or the doctor will be considering many factors for treatment. First is the patient's general condition. It determines the patient's age, sex, how healthy a patient is. All those factors will be coming under patient's general condition. Second thing is whether this cancer or whether this tumor is a localized one. Localized one means or a particular area will only be involved. Or if it is having distant extent of disease, means the cancer would have spread to different areas. So in such cases, which type of modality or which type of treatment should be followed will be determined by the radiation oncologist, or the doctor or the specialist who is seeing this patient. And the tumor management decisions require multidisciplinary approach. So with this, before I have said one example, if a breast cancer patient is coming, and depending upon that lady's general condition and depending upon the staging of the tumor and all those things, we will determine which modality, whether this patient have to be sent to first for surgery, then the doctor will be reverting her to the surgical oncology department, and the patient will be undergoing surgery. Afterwards she will be coming under chemotherapy department. She will be doing chemotherapy, and along with that moving ahead with radiation. So depending upon the patient's physical condition, local and the distant extent of the disease, the treatment will be determined by the specialist. So each patient should be individually assessed by a team of specialists. Let us move ahead to a brief history of radiation therapy. So the first patient was treated with radiation in 1896. X-rays was discovered on 1895 by W.C. Röntgen. Back then, both doctors and non-physicians treated cancer patients with radiation. At that time itself, they started treating cancer patients with radiation. Rapid technology advances began in the early 1950s with cobalt units. Okay, so beginning was with cobalt units, followed by linear accelerator, tomotherapy, and now at last cyberknife. Recent technology advances have made radiation more effective and precise. These are the methods of delivering radiation therapy. In early 50s you can see, and you can see today what is happening. Radiation therapy, RT. Radiation therapy uses high energy X-rays. So from that sentence itself you understood that we are using X-rays for treatment. Yes, the mode of beam we are used in radiation therapy nowadays are X-rays. But the X-rays are different from that we are using in radiology department for taking X-ray images are different. Here we are using high energy X-rays. And it is aimed at the tumor to kill the cancer cells within it. These X-rays have been directed at the tumor with accuracy so that the cancer gets hit and normal surrounding tissues are secure. So the X-rays are directed to the tumor cells and that cells are killed by the radiation. Okay. In simple terms, the high energy X-rays work by damaging the cell nucleus and stopping the cell from dividing. The spontaneous division of the cells will be stopped with these X-rays. Normal cells can be affected. Some sort of normal cells can be affected surrounding this tumor site, but they are able to repair by themselves. Biological basis of radiation therapy. The cells can be killed by ionizing radiation. X-ray is an example for an ionizing radiation. Most important target appears to be nuclear DNA. Radiation damage to DNA result in non-viable offsprings. Rapidly dividing cell population. Yes, a cancer cells are rapidly dividing cell population which are more sensitive to the ionizing radiation. Okay, so we are using radiation as a mode of treatment for treating cancer patients. So the aim or goal of radiation therapy. The goal of radiation therapy could be simply stated as, it can be simply defined as deliver a high dose to all parts of the tumor while minimizing the dose to the surrounding normal tissues. So the main two categories of radiation treatment are radical treatment as well as palliative treatment. Radical treatment means to cure the disease. We have to get a complete cure to a patient. As I discussed in the before slide, the general condition of a patient is an important factor for radiation treatment also. Depending upon the condition and the staging of the tumor, we will determine whether the treatment is radical or palliative, whether that patient will be completely cured from the disease or whether the patient will get only relief from the symptoms of the disease. If that patient is getting only relief from the symptoms, In order to get relief from the symptoms, we will be giving radiation, and such type of treatment is known as palliative treatment. So let us meet the teams of radiation therapy or radiation oncology department, who all comes under that department. First is the doctor. As you all know, doctor is the main pillar for the department. Radiation oncologist, the doctor who oversees the radiation therapy treatment. Thereafter comes the medical radiation physicist. They have an important role in our department, ensures that complex treatment plans are properly tailored for each patient. Then comes the dosimetrist, works with the radiation oncologist and the medical radiation physicist to calculate the proper dose given to the patient. We are giving some radiation dose to the patient, and all those things will be discussed in next topic. I am not going deep into that areas. We will be discussing on that in our next topic, radiation units and measurements. Then comes the radiation therapist. We all belong to this category. Administers the daily radiation under the doctor's prescription and supervision. Radiation oncology nurses will be there. They will be taking care for the patient and the family by providing proper education, emotional support and tips for managing side effects. Types of radiation therapy. Radiation therapy can be delivered in two ways, externally as well as internally. Externally, we are giving radiation to a patient using a linear accelerator. It is an advanced modality, and in that we are using high energy X-ray beams. And the second thing is the internal radiation therapy called brachytherapy or seed implants, which involves placing radioactive sources inside the patient. This means the sources will be going inside the patient and delivering the radiation to that particular site. The type of treatment we'll use will depend upon the location, size and the type of the cancer. As I discussed in the previous slide, type of cancer is an important factor, location of the cancer is an important factor, as well as the size, how much size a cancer have begun. It is an important factor. So depending upon that, we will be giving external beam radiation therapy or internal radiation therapy. Is radiation therapy safe? Many advances have been made in the field to ensure it remains safe and secure. Multiple healthcare professionals review the treatment plan to ensure that the target area is receiving the dose of radiation needed. The treatment plan and equipment are constantly checked to ensure proper treatment is given. And what all are the workflow in a radiation therapy department will be discussed later. From that you will be getting more idea of about target area and how we are planning a patient for radiation. With that, I am coming to the end of this session. Hope you all understood and enjoyed the sessions. If you are enjoying my sessions, stay tuned for my next topic. If you like my channel, please don't forget to subscribe and like this video. We will see you soon. Until then, bye.